just going to be helping you counseling your medications and get them organized because you're going to be discharged home today after your stay in the hospital. So you're here for some complaints of chest pain.
Yeah.
Okay, and then those are determined as a non-cardiac origin, so that's actually good to hear. But the physician's sending you home today with a few new medications. He's also changing your regimen a little bit. So we're gonna get that organized and make sure that you're educated and know what's going on in regards to your medication regimen. So there's a few issues that we're aiming to address, and it's going to be your blood pressure, your cholesterol, your acid reflux, and your pain. So we're gonna get those three problems addressed so we can prevent any further complications or visits to the hospital. So the first problem we're going to address is your hypertension. So we have 3 total medications that we're going to be giving you to control your blood pressure.
Okay.
You were previously on Procardia, is that correct?
Yeah, I believe so, but I wasn't really taking it because it was kind of expensive and I didn't really want to pick it up.
Okay, so that's actually, we hear that a lot. It's an expensive medication, so we're actually going to discontinue that medication and actually alter your regimen a little bit. So for the Procardia, to start that off, that's going to be discontinued. You can dispose of that. You can bring it to any pharmacy and they'll instruct you how to dispose of it. But any of that medication, you don't have to take that anymore. You can actually just get rid of that as soon as possible so you don't take it on accident or anything like that. So one of the new medications we're going to give you is called atenolol, and the strength is 25 milligrams. You're going to be taking it once a day. So that's one of the new medications your doctor added to the regimen. Some things that you should know about it, you want to kind of avoid any activities that are going to require like increased mental alertness because it can affect how your brain processes things, but it's not going to be super serious. But just make sure that while you're on this medication, you're not like operating a lot of heavy machinery and things like that. You're going to take the drug on an empty stomach, and if you do miss a dose, it's a once-a-day drug. So if you do miss a dose, you can just wait till the next dose. You don't want to double up a medication or take it too close to your next scheduled dose. So just take it as soon as you remember, medication as soon as you remember. But if it's close to the next scheduled dose, you can just wait till that next scheduled dose. So the drug also might mask any symptoms of hypoglycemia. So you might, if you ever feel like you're dizzy or weak, it could be your blood sugar. So make sure you check your blood sugar. And some other things that can happen are maybe a little bit of tiredness, insomnia. So just be aware of that. And then there's another hypertension medication we're going to be on. It's called hydrochlorothiazide. The strength is 25 milligrams. You'll also be taking that once a day. It's a diuretic, so it's going to help you get rid of that extra fluid that's in your body and help decrease your blood pressure. And some side effects also, this one is like dizziness. It can alter your electrolytes so that you can get a little bit of weakness, things like that. Headache, a little bit of nausea maybe, so you can take it with food as well. And same thing as if you miss a dose, you just take it as soon as you remember. If you remember it closer to the next scheduled dose, you can just wait till that dose. You never want to double up on these medications. And then your third hypertension medication is called lisinopril, and that strength is 40 milligrams, and you're taking it once a day. And you're actually already on that medication before previously, right?
I think so.
Okay, so there's nothing changing with that medication. That's the same strength, same schedule, and similar side effects. Just monitor for any like signs of weakness or nausea, things like that. But that's the same medication you've been on previously. And then some things that, in addition to these 3 hypertension medications to control your blood pressure, we're going to try and emphasize exercise these 3 times a week, monitoring your sodium intake. We have here like the max is probably about 2.4 grams, and then avoiding any processed foods like potato chips, things like that. So those are the 3 medications that you're on. And can you tell me how often these medications will be taken, just to make sure that you hear?
I know it's once a day, but you said that for the first one to take you on an empty stomach.
Yes.
Does it matter for the other 2, and can I take all these 3 together?
You can take all 3 together on an empty stomach. Just make sure that if you do feel any nausea afterwards, you can try and eat a little something small. But the atenolol is more emphasized taking an empty stomach, just to increase the strength of the drug. But to make it easier on yourself, you can take all 3 at the same time. That's fine.
So probably like when I wake up.
Yeah, you can just take it when you wake up in the morning. That's perfectly fine. Okay, and then so your next issue that I mentioned earlier is the cholesterol. So we're gonna initiate some medication to address that issue. You're previously on Lipitor, is that correct? The atorvastatin?
Yeah.
Okay, so we're gonna actually increase the strength of that medication. You're previously on 10 milligrams, and now we're gonna increase it to 40, and that's 40 milligrams, 1 tablet by mouth daily. Just because due to these other complications you have, we're gonna determine that you need a more aggressive regimen for that issue. So you can take this medication in the morning, same time each day. Swallow the tablet whole, don't break it, because that'll mess up with the mechanism of how the tablet works in your body. And similar things with the missed dose as the hypertension medications. Just take it as soon as you remember. If you forget and you remember close to the next scheduled dose, just take it then. some possible side effects are myalgia, a little bit of muscle pain. That's pretty common. But if it gets to a point where it's intolerable, you can always see your doctor, and then we can change your medication regimen. And also, this medication can cause a rare side effect called rhabdomyolysis. So if you ever see any dark urine or any like lower back pain, or also yellow skin, vomiting, you can report that to your doctor, and because that's an emergency situation. Again, it's rare, but you want to make sure you're monitoring what your urine looks like, what your stool looks like, just to make sure there's no serious side effects happening. Okay, so just to make sure you heard me about that medication, how often are you taking this Lipitor?
I think once a day, you said,
Once a
and
day.
I can take it with the other medications at the same time.
Perfect. And then do you know, is it the same dose as before or a new dose?
I think you told me that it was a little bit higher.
Yeah, higher. So the old dose, you can same thing, just like you can dispose of it. You're not gonna be taking that anymore. You can take it to a pharmacy and they'll dispose of it for you, or direct you to somewhere where you can dispose of it. Next medication is for your acid reflux, because the doctor possibly thinks the acid reflux is what caused that chest pain.
Okay.
So we're going to address that and try and get that under control. So we're going to give you Protonics, 40 milligrams PO twice a day, or PO oral, sorry. But it's twice a day, and that's going to control the acid release in your stomach, so you don't experience any pain, chest pain, things like that. You're going to take this medication with breakfast and with dinner probably. It's supposed to be taken with your big meals to avoid that acid release. And it's going to take 2 or 3 days to work, so be patient. If it doesn't happen right away, you still feel a little bit of reflux, it's going to take a few days to work.
Okay. And does this medication have a generic to
This
it?
does have a generic. It's called pantoprazole. So if you, if it's written as Protonics, but if your insurance has it as a high price, the pharmacy can also change it to a generic,
Okay,
just to
just
make
wanna
sure.
that I
Yeah.
can afford
So
it.
these it's going to be pretty obtainable. It's not going to run you too much.
Okay.
And also as in combination with this medication to decrease any risk of the acid reflux, you can avoid late night meals. I know you work 2 jobs, but it's a key that you avoid those late greasy meals, just to also remain upright after meals. Don't try and lay down right after. And also, I know you're a little bit of a social drinker, so avoid alcohol and coffee too, because that's going to exacerbate that acid reflux. Okay. And also, your last medication is for the pain. I know you're complaining a little bit of lower back pain that wasn't controlled by any over-the-counter medications. So what the doctor is giving you is lidocaine. It's a patch, and it's 5% strength, and you're going to apply it every 12 hours. So you take the patch and you apply it to the lower back area for 12 hours. You can leave it on there for the whole 12 hours. You can take it off if you don't want to. But the key is that you're going to apply it 12 hours on, and then the rest of the day you can't have it on. So it's 12 hours on, 12 hours off. You're not going to apply more than 1 patch per day.
Okay, so 1 patch.
One patch, just do 1 patch per day. You can cut the patch however you want, just to fit it wherever you want, but you can't apply 2 patches. You can't do 2 a day. Just do 12 hours on and 12 hours off to control your pain.
If it doesn't work too well, can I take some Advil over the counter?
You can take, so there's medications called NSAIDs. It's like ibuprofen and then naproxen. Those are going to be not recommended for you because they can exacerbate any kind of gastric bleeding because you have that history of that bleed.
Oh, okay.
So we're not going to recommend that, but you can take other over-the-counter medications. You can take a aspirin, I think, a little bit.
Or I can take Tylenol,
Tylenol,
because that's what
yeah.
I've been taking.
Okay, you can take Tylenol, but doesn't control it. Okay.
Yeah, but maybe if I add it to the lidocaine, then it would be.
Yeah, so you can take the Tylenol and that's fine, but the lidocaine is supposed to be the topical treatment, but no aspirin, no NSAIDs, because those will exacerbate a bleed possibly.
Okay.
And also, the patch is not waterproof, so if you go swimming or showering, you're not going to be able to wear the patch. It's not going to stay on.
Okay.
And also, you might have some redness or burning, itching in the same area as that patch. So that's normal, but if it gets too bad, you're going to stop wearing the patch. Okay, and you can also, another thing, if you use a heating pad, you're not going to want to use that at the same time as the patches. That's dangerous. It's going to burn, or you don't want to use that at the same time.
Okay.
All right, so one key question I want to ask you about the lidocaine, just make sure you remember, how long can you keep the patch on?
I said I can only have 1 patch a day for 12 hours,
12
and
hours.
then after the 12 hours, I can't put another one on, so it's 12 hours on, 12 hours off.
Perfect. Okay, so that's all the medications. So it's a total of 6 medications, and one of them's new, one of them's old. The Lipitor is the new dose, but the same medication. Also, the Lisinopril is the same medication you taken before.
Okay.
And just follow up with your primary care provider in 2 weeks just to make sure that those medications are doing what they're supposed to do, and if you report any side effects that you're experiencing. And also, with the blood pressure, you're going to want to purchase a measuring cuff. Do you have a blood pressure measuring machine?
I do not.
Okay, so you're gonna.
But I think some grocery stores have those.
Okay, so you're going to go purchase one of those just so you can monitor your blood pressure and see if the medication's working, or if you're experiencing any side effects, you see if it's correlating with your blood pressure. Okay, do you have any other questions for me?
Just to clarify, the ones that I have at home, I just can bring it to like a disposing medication.
Yes, perfect. Yeah, so if you don't know how to dispose of it, you just take it to a pharmacy and they'll just direct you on how to dispose of those medications. Okay, but we'll print out a new list for you to make sure that this list is the only medication that you're taking, so you know you're clear what medication to dispose of and which ones to keep if you forget on when you go home.
Okay.
Okay. Any other questions?
I think that's it.
Okay. You have a great day.
Thank you.